Hello, everyone. My name is Doug Koch from the Cullen Institute at Baylor College of Medicine, and this is the next in our series on IOLs, what every surgeon should know. And I'm really happy to have Julie Schallhorn with us. Julie is professor of ophthalmology at University of California of San Francisco and the Rose B. Williams Endowed Chair in Corneal Research. And our topic today is a kind of an interesting, kind of a little bit of a gray topic, which is extended depth of focus, or EDOF or EDF IOLs. So welcome, Julie.
Yeah, thanks so much for having me, Doug. This is a great topic and happy to be here to discuss it.
Yeah, great. So first of all, what is an EDF or an EDOF? How do we classify them or talk about them?
Yeah, it all comes down. It's an interesting kind of like intermediate area, and it all comes down to how much depth of focus the lens provides. So, in extended depth of focus lenses, they have a greater depth of focus than monofocal lenses, but not as much as a continuous range of vision or a multifocal lens. There's very specific criteria that the lens has to meet per like ANSI standards and FDA regulations in order to be classified as this. And it comes down to the depth of focus you get at a 20/30 level at a distance of like an intermediate distance. And if you're able to demonstrate about a diopter greater defocus or half diopter on either side of that mark, but a diopter total range defocus at that, you can get the extended depth of focus label to your lens, which then puts it into the premium lens category, which is of course like a separate, billing, nomenclature. But that is what an extended depth of focus lens is. It is totally irrespective of the mechanism that which you get to that extended, that increase in depth of focus. So we see multiple different lenses with multiple different optic designs that can do that.
Tell us a little bit about the optical designs of these EDOF lenses.
Yeah, so the kind of the two major options, there's the diffractive lenses and the refractive lenses. Diffractive lenses use a similar design that we see in all of our trifocal lenses or multifocal lenses with the diffractive kind of form on the surface of the lens. Unlike a trifocal lens where the spacing is tighter, the spacing between those rings is much greater in the extended depth of focus version. So you get less of a separation between the near and the distance focal point. So you get an intermediate focal point, a distance focal point, but you don't have a near focal point. That comes with less range of vision, but on the plus side, because you don't have as tight spacing, you maybe have a little, and again, it's, you can't really compare lenses to lenses directly because we don't have any directly comparative studies, but theoretically, you should get less photic phenomena, particularly at nighttime, less ringing around lights, although you will still see that because it is a nature of the diffractive platform. Also, theoretically, improved contrast sensitivity with that lens under more variety of conditions. The other option is the refractive profile of a lens. There is currently one refractive EDOF lens available in the United States. It is the Acrosoft Vivity from Alcon. That lens operates on a completely separate optical profile. In the center of the lens, you have this little kind of like donut of effectively just increased refractive power. So you've got a constant refractive power and this donut of increased refractive power, which in the center of the lens shifts the focus towards an intermediate focal point. So you get that intermediate and that distance from the periphery of the lens with the Alcon platform. Because you don't have the diffractive kind of form on that, you will see theoretically less ringing around lights, although patients on average report a little bit more halos with the Vivity than they do with other lenses. Notably with that Alcon Vivity, because you are, changing the refractive power of the lens, it's not uniform, you do have some loss of contrast sensitivity relative to a monofocal control IOL with that. So something to be aware of when you're implanting
Yeah,
these.
it's interesting, in our clinical practice, since these lenses are neither, you use the old expression, fish or fowl. They're not distance. They're not near. Where do they fit in your practice?
It's a really good question because they don't, they're not lenses that are going to give somebody true spectacle independence. And partially you will see people report like, oh no, I had a patient that I did bilateral vivities in and they're completely glasses independent. And you will see some patients are like that, but it's probably a combination of patient characteristics, what they're doing, and also probably a component of pupil size inside the eye as well. But broadly, these lenses are not going to give you complete spectacle independence. Patients will still need readers. They will still need more light in certain circumstances. To improve spectacle independence in this population, there have been a subset, and there have been studies reported on this, looking at like a mini monovision type approach where you do the dominant eye for hard plano, the non-dominant eye you leave undercorrected in a mini monovision type to kind of extend that range of vision, showing improved near vision versus a bilateral distance target. You do have the trade-offs of a monovision approach with that, which is of course, loss of stereopsis once you kind of exceed a certain threshold. In my practice, these lenses, I'd say I don't use them as much anymore. I think they were really a great lens for some patients, and they're still great lenses for some patients. I tend to go towards them in patients who particularly the diffractive one, who have a strong dominant eye and want to minimize photic phenomena in that dominant eye is a great option for a Technis Symphony. For the Vivity, I think those actually do quite well in small pupil patients who are a little bit tolerant of a mini monovision type approach. So I think that's probably where that works best, at least in my practice. But all things being considered, the modern trifocals actually perform really, really well in terms of intermediate and near vision. So I think kind of eating into this EDOF market a little bit.
Yeah, it seems like the quality of the optics of the new trifocals we have are so amazing that we don't feel like we're compromising quality of vision like we did before, and so that really eats into, as you say, the use of the EDOF lenses. So, final question: what's coming down the road?
Oh man, I think this is a very active field. I think there's been a lot of exciting stuff actually happening in refractive optics in EDOF and maybe even a little bit more than EDOF lenses. There's the Technis PureC, which the optical it's a refractive EDOF, but at least the defocus curves that I've seen are probably more than the current EDOFs a little bit. Lens, which the photic profile of it looks quite nice, at least from the optical bench studies. There's this whole monofocal plus category of lenses to have some characteristics of an EDOF, but fit into the monofocal pathway and the payment pathway of a monofocal lens. There's a French company that's doing some really neat stuff with optics, EDOF optics as well. So I think we're going to see continued growth in this and continued innovation, which is good for patients and exciting for people that like lenses like
It's
us.
amazing that people still can come up with creative ways to split light and make our vision for our patients better. It's pretty cool.
Indeed, it is really cool. It is really cool.
Julie, thank you so much. Really enjoyed talking with you.
Of course. Thanks so much. Thanks so much for having me, Doug.